I'm going to, you're going to push and twist. So you're going to push on and you're going to twist it. And it should stay. Okay, so when I push it on, see how it measures cuff pressure? Mm-hmm. What I want, I don't want it to be, what I'm wanting it to be is in the green. So, I'm not sure why this isn't holding. Every time I check it, normally the spring does not stick. So you check it, and it'll read, usually you want it in the green. If it's not in the green, you hit this red button on the side, and it lets the air out. If you want more air in, if you squeeze the bulb, it pushes air in. Except for in this case. And it's, obviously there's an issue with this pilot balloon. Huh? So see, we want it in the green. So that's what you're going to do. If it's too high, push the red button, let air out. If it's too low, you can squeeze this and put air in, or you can take it off and put air in with your syringe. Okay, so you're going to measure the cuff pressure.
When you measure it, will it stay in the green, or will it only be there for like a second?
No, it stays in the green.
Okay.
He's not working. He's, we'll see, because I'm going to switch tubes and give you a different tube. So no, normally when you push it on, it'll stay wherever it's at.
Okay.
Until you let air. Although every time you push it on and let it out, push it on, remember it's like a bike tire. Every time you push it on, it lets a little air out. So if you keep doing it repeatedly, obviously you're going to let air out. So every time you do it, but it's just a small amount of air. Okay, so now we have him on that. Now I'm going to have you suction with the Ballard. So let me grab a Ballard. Now a Ballard is an inline suction. So your Ballard is going to, here's what you're going to collect your squeeze specimen. So the Ballard is going to attach directly to the airway. And let's see, on this one. It'll work just like the teeth. So it's kind of just replacing the teeth. Okay. So I would have my suction tube hooked up, and you're going to have yours already hooked up. So my suction tube, which comes from my canister, is going to hook right to my Ballard. Now the benefit of the Ballard is, because I have this, I don't have to put my sterile gloves on and all of that. This stays in line, so it stays there all the time. And I can just suction with this, and I don't have to go through sterile technique, and I don't have to disconnect him to suction. Okay? So when I suction with my Ballard, and you'll see on your sheet, it'll say the pressure is actually a little higher. So instead of it being at the vacuum regulator being at 120, the manufacturer recommends 140 to 160. So the suction's a little higher. So you're going to suction. So what you always want to do is you're going to hold the airway with one hand. So with this one, I'm holding the airway. I'm going to advance my catheter down, advance it down, okay, until I feel resistance or a cough reflex, and then I suction back. Now this locks the little thumb suction. So if it got depressed by accident, it wouldn't be applying suction. So before you use it, you want to make sure it's unlocked. Hold your tube with one hand and advance it down with the other. So advance it down again until you see a cough reflex or you feel resistance, and then you suction back. Okay? Now if you're going to suction to get a specimen, you're going to hook your sputum specimen in line. So see how it's between the two? So instead of whatever you suction out, instead of the sputum going through the tube and into the canister, it's going to end up in here, so you can send it to the lab. The reason why I would want a sputum specimen is, what if I'm not sure what kind of growth the patient has in their lungs? Like maybe we don't know what bacteria the patient has. They'll send it to the lab and they culture it on a petri dish like you did in microbiology or you will do, and they'll be able to identify what is growing, and they'll be able to identify what it's sensitive to, like which antibiotic it's sensitive to. So I do it the same way. So I make sure this is unlocked, and I'm going to advance it down slowly. Resistance, and I suction back. Okay, and then whatever is in here is what we send to the lab. Now sometimes you suction and it ends up here, but it's not a lot, or maybe it's thick and it hasn't gotten into the catheter, into the canister. What you can do, let me grab some saline, we can use saline to flush it in. So we can also, now remember, I take the cap off, I attach saline here. So while I squeeze this, I squeeze the saline. So therefore the saline will go into here. It'll flush everything that's in the catheter through. So you can actually use the saline. It's okay that there's saline in with the sputum or the mucus, because saline is not bacteriostatic, meaning it won't prohibit bacterial growth. So it's not going to affect the specimen. This may just be one way to get. And how much is, it's just like when you do like a urine culture, whenever they say go collect urine, you're like, oh, should I, do they want it full? Should I cap it, top it off? Here you go. Or should I just give a little, So that's the same thing with this. You're like, well, how do they want the whole thing, or they just want? Actually, the bottom has to be covered. So you want the bottom of this at least to be covered. It doesn't have to be, they don't give you this size because they want you to fill it up. Just make sure the bottom is covered, whatever you suction out. And if the bottom's not covered, try again. Suction them one more time. Okay, so once I'm done suctioning, I'm going to reconnect that. Now I take my sputum specimen. How this works, this piece comes off, this flips over. It's just a rubber piece that goes on the end. I put the label, the patient's label on here, and I put it in a biohazardous bag and I send it to the lab. So that's what it looks like. So then the lab gets it, and then so that's how you're going to do the sputum specimen. And then you're going to do the exact same thing. So you're just going to suction out, but you're going to do sterile technique. So sterile technique, you're going to have it attached like this. So it's going to be waiting, all ready to go. Try to set it there. And then you're going to use your sterile gloves. And your partner will disconnect the patient for you, and then you're going to stick your catheter into the endotracheal tube and suction with sterile technique like we did. Remember when we suctioned the nose? Only you're just going to go through the tube. Okay, so that's what you're going to do for suctioning. So you're going to suction, you're going to check your cuff pressure, and you're going to suction 2 ways. Okay, now that I've suctioned, I'm ready to extubate my patient. And usually your patient's going to be responsive. So Billy, are you excited about getting this tube out? Now, is he going to be able to say no because he can't talk? But he'll be like, oh, please, please. Okay, so to suction, I'm going to suction the tube. So first I'll suction the tube because this is my last opportunity to suction him before I pull the tube out. So I want to make sure I suction the tube. Okay, and I'm going to also suction the back of his mouth. So if he has anything in the back of his mouth, okay, I don't want all that stuff to go into his lungs. And I leave this attached, okay? So I'm going to leave that attached. Then I'm going to give him some oxygen breaths. So I'm just going to give him some oxygen breaths. Remember, it's attached to the flow meter. Okay, some oxygen breaths. Then I'm going to keep this attached. So then I'm going to untape my tube. Okay. Then I'm going to deflate my cuff. And I know it's completely deflated because my pilot balloon will be flat. So it's completely deflated. Okay, Billy, what I want you to do is take a deep breath for me. Deep breath and cough. And I pull it out. And once I pull it out, I'm going to disconnect this. I'm going to suction out the back of his mouth because they usually start coughing at this point. And then I'm going to put him on an aerosol mask. Okay? So he's going to be on his aerosol mask. Okay, and now that he's on his aerosol mask, I'm going to listen for stridor. So where I listen for stridor is that's airway inflammation. So I'm going to listen over the neck for stridor. Then I'm going to listen over the right lung and the left lung. I'm going to assess his heart rate, his respiratory rate, and his oxygen saturation. So that's all you do to extubate.